Hi there, it's Tim, the exercise physiologist here at Executive Medicine. And today I just wanted to talk to you about mobility and why that is important for you. So, when we talk about mobility, we're talking about the range of motion that someone has in their joints, but also the stability to control those movements. So, when we do a range of motion assessment here at Executive Medicine, we look at your neck and shoulders, your spine. If you have particular injuries, we can look at specific joints and how they are moving as well. But the reason we want to do this is we want to make sure that you have a relatively normal range of motion. So that's going to help you move more freely and easily. There is research out there that having good range of motion can be reducing your risk of injuries. But there is also a caveat to that, which would say that there is many factors that can cause injury, so not just mobility and stability of the joint, but and also another point from looking at someone's mobility is when you do have an injury, we can then compare that joint to the non-injured side and see how someone is improving over time with their rehabilitation, so they're getting back to their normal ways. So how can you improve mobility? Well, you want to do dynamic mobility exercises, so that could be moving the joint through the full range of motion. So you've probably seen a lot of people doing like open the book exercises for their thoracic spine, maybe a cat camel movement for their whole spine moving together, doing some calf raises, doing some neck range of motion. So you're moving the joints through the normal range of motion that they can achieve that is pain-free. And over time, if you are limited in those mobility joints, you should be seeing an improvement in your range of motion. It is also worth noting that to improve mobility, strength training is really important. So loading up joints can improve your flexibility and range of motion. Doing stretching is also important. So that could be a static stretch where you hold a stretch for 30 seconds to a minute, and over time you should see a little bit of lengthening of the muscles and improve your flexibility and range of motion. But also doing stability exercises, so doing shoulder stability exercises or glute strengthening exercises are important. So there's not just one particular exercise to improve someone's mobility. It's a range of exercises that can be tailored to that person to reach their goals and improve their mobility and flexibility. But if you need any further assistance on range of motion, mobility, flexibility, please contact us here at Executive Medicine and we're happy to help you out. Thank you. Just some other examples of way to improve your mobility is also doing yoga, meditation, mindful breathing where you're using your diaphragm, trying to manage any stress and anxiety in your life, because we know those type of factors can increase muscle and joint tightness, which can reduce your range of motion and your mobility. So those type of exercises and activities can also improve your flexibility by reducing the tightness that you feel during a movement.